CST exam questions and answers. Question 1. Which of the following is the wound classifications for a bronchoscopy? Option A, clean. Option B, contaminated. Option C, dirty and infected. Option D, clean contaminated. The correct answer is option A, clean. Question 2. Which of the following structures is located in the alveolar processes? Option A, teeth. Option B, sinuses. Option C, tonsils. Option D, villi. The correct answer is option A, teeth. Question 3. The enzyme used to soften the zonule of the lens before cataract surgery is: option A, atropine sulfate. Option B, alpha-chymotrypsin. Option C, acetylcholine chloride. Option D, pilocarpine hydrochloride. The correct answer is option B, alpha-chymotrypsin. Question 4. When perforated metal trays are placed on the shelves of the steam sterilizing cart, they should be positioned: option A, flat. Option B, upside down. Option C, vertical. Option D, angled. The correct answer is option A, flat. Question 5. How should the stretcher be oriented when necessary to use an elevator to transport a patient to the OR? Option A, place stretcher sideways in elevator. Option B, enter head first, exit feet first. Option C, position in elevator is irrelevant. Option D, enter feet first, exit head first. The correct answer is option B, enter head first, exit feet first. Question 6. Which of the following is a curved, transverse incision across the lower abdomen frequently used in gynecological surgery? Option A, midline. Option B, paramedian. Option C, McBurney's. Option D, phalansteal. The correct answer is option D, phalansteal. Question 7. Hyperkalemia is a high concentration of: option A, calcium. Option B, nitrogen. Option C, potassium. Option D, albumin. The correct answer is option C, potassium. Question 8. Permission for treatment given with full knowledge of the risks is A/N. Option A, tort. Option B, malpractice. Option C, personal liability. Option D, informed consent. The correct answer is option D, informed consent. Question 9. Which of the following tissues are cut using curved Mayo scissors? Option A, fascia. Option B, periosteum. Option C, dura mater. Option D, arterial wall. The correct answer is option A, fascia. Question 10. Which laser beam can travel through clear tissues without heating them? Option A, argon. Option B, excimer. Option C, carbon dioxide. Option D, neodymium, YAG. The correct answer is option A, argon. Question 11. Which portion of the stomach surrounds the lower esophageal sphincter? Option A, cardia. Option B, fundus. Option C, pylorus. Option D, antrum. The correct answer is option A, cardia. Question 12. Low-level disinfectants kill most microbes, but do not destroy. Option A, viruses. Option B, bacteria. Option C, fungi. Option D, spores. The correct answer is option D, spores. Question 13. The surgical pack utilized to create the sterile field should be opened on the: option A, stretcher. Option B, or table. Option C, back table. Option D, Mayo stand. The correct answer is option C, back table. Question 14. The islets of Langerhans secrete: option A, bile. Option B, insulin. Option C, intrinsic factor. Option D, inhibiting hormones. The correct answer is option B, insulin. Question 15. What type of procedure would involve the removal of teeth? Option A, cleft palate repair. Option B, arch bar application. Option C, extraction. Option D, implants. The correct answer is option C, extraction. Question 16. Which organism is a normal resident flora of the intestinal tract? Option A, Escherichia coli. Option B, Staphylococcus aureus. Option C, Pseudomonas aeruginosa. Option D, Clostridium tetani. The correct answer is option A, Escherichia coli. Question 17. Syndactyly refers to: option A, cleft palate. Option B, webbed fingers. Option C, fused tarsals. Option D, torn ligaments. The correct answer is option B, webbed fingers. Question 18. Where should the first scrub surgical technologist stand when handing towels to the surgeon to square off an incision site? Option A, opposite side from surgeon. Option B, same side as surgeon. Option C, foot of or table. Option D, head of or table. The correct answer is option B, same side as surgeon. Question 19. A properly performed surgical scrub renders the skin: option A, sterile. Option B, disinfected. Option C, surgically clean. Option D, moistened and dehydrated. The correct answer is option C, surgically clean. Question 20. Through which of the following do the common bile duct and the pancreatic duct empty? Option A, ampulla of Vater. Option B, duct of Santorini. Option C, Wirsung's duct. Option D, sphincter of Oddi. The correct answer is option A, ampulla of Vater. Question 21. Which of the following identifiers must be verified by the patient or their ID bracelet prior to transporting a patient to the OR? Option A, name, social security hashtag, physician. Option B, name, medical record hashtag, allergies. Option C, name, date of birth, diagnosis. Option D, name, date of birth, physician. The correct answer is option D, name, date of birth, physician. Question 22. What are spiral-shaped bacteria called? Option A, bacilli. Option B, cocci. Option C, spirally. Option D, diplococci. The correct answer is option C, spirally. Question 23. The primary function of the gallbladder is to: Option A, metabolize fats. Option B, produce bile. Option C, emulsify fats. Option D, store bile. The correct answer is option D, store bile. Question 24. Which of the following is a non-sterile member of the surgical team? Option A, surgeon. Option B, surgical assistant. Option C, surgical technologist. Option D, circulator. The correct answer is option D, circulator. Question 25. Which of the following is not a benefit of using surface-mounted sliding doors for access to the operating room? Option A, uses less space for opening. Option B, aid in controlling temperature. Option C, eliminate air turbulence. Option D, provides for thorough cleaning. The correct answer is option B, aid in controlling temperature. Question 26. What are the three factors for reducing ionizing radiation exposure? Option A, type of procedure, equipment, radiation dose. Option B, time, shielding, distance. Option C, exposure, frequency, concentration. Option D, site, age, gender. The correct answer is option B, time, shielding, distance. Question 27. What is the surgical position frequently used for patients undergoing kidney surgery? Option A, lithotomy. Option B, lateral. Option C, supine. Option D, prone. The correct answer is option B, lateral. Question 28. How are rickettsia transmitted? Option A, arthropod bites. Option B, airborne organisms. Option C, physical contact. Option D, blood exposure. The correct answer is option A, arthropod bites. Question 29. Which of the following is an examination of the cervix using a binocular microscope? Option A, colposcopy. Option B, laparoscopy. Option C, urethroscopy. Option D, hysteroscopy. The correct answer is option A, colposcopy. Question 30. Compression of the heart from excessive fluid of blood buildup is called: Option A, pericarditis. Option B, infarction. Option C, tamponade. Option D, cardiomyopathy. The correct answer is option C, tamponade. Question 31. Which surgical team member determines when the patient can be transported from the OR to the PACU? Option A, anesthesia provider. Option B, surgeon. Option C, circulator. Option D, surgical technologist. The correct answer is option A, anesthesia provider. Question 32. Which suffix means surgical puncture to remove fluid? Option A, dynia. Option B, tomy. Option C, lysis. Option D, centesis. The correct answer is option D, centesis. Question 33. To which portion of the colon is the appendix attached? Option A, ascending. Option B, cecum. Option C, descending. Option D, sigmoid. The correct answer is option B, cecum. Question 34. Which laboratory test determines bacterial identification? Option A, gram stain. Option B, manual count. Option C, gel electrophoresis. Option D, prothrombin time. The correct answer is option A, gram stain. Question 35. Medication used to dilate the pupil is called: Option A, miotics. Option B, myopics. Option C, mydriatics. Option D, muscarinics. The correct answer is option C, mydriatics. Question 36. Which of the following drapes is non-fenestrated? Option A, U-drape. Option B, transverse. Option C, craniotomy. Option D, laparotomy. The correct answer is option A, U-drape. Question 37. Under what circumstances would it be appropriate to remove a patient's identification bracelet? Option A, never until patient is discharged from facility. Option B, during insertion of N4 catheter. Option C, postoperatively when taken to the nursing unit. Option D, when patient is awake and alert and can verbally identify self. The correct answer is option A, never until patient is discharged from facility. Question 38. What is the position most commonly used for mitral valve replacement? Option A, prone. Option B, Sims. Option C, supine. Option D, Krask. The correct answer is option C, supine. Question 39. Which microbes live without oxygen? Option A, capnophiles. Option B, microaerophiles. Option C, anaerobes. Option D, aerobes. The correct answer is option C, anaerobes. Question 40. Which is the first part of the small intestine? Option A, duodenum. Option B, jejunum. Option C, ileum. Option D, cecum. The correct answer is option A, duodenum. Question 41. What laser is best used during a vitrectomy? Option A, carbon dioxide. Option B, ND-YAG. Option C, excimer. Option D, argon. The correct answer is option D, argon. Question 42. Which of the following monitors provides positive assurance of sterility? Option A, chemical. Option B, mechanical. Option C, biological. Option D, clerical. The correct answer is option C, biological. Question 43. Which of the following is an abnormal tract between two epithelium-lined surfaces that is open at both ends? Option A, herniation. Option B, sinus. Option C, fistula. Option D, epithelialization. The correct answer is option C, fistula. Question 44. What is the action of antagonist drugs? Option A, inhibit the clotting process. Option B, achieve neuroleptanesthesia. Option C, increase the effects of opiates. Option D, counteract the action of another drug. The correct answer is option D, counteract the action of another drug. Question 45. Which of the following directional terms describes the type of skin prep of an entire extremity? Option A, spiral. Option B, horizontal. Option C, longitudinal. Option D, circumferential. The correct answer is option D, circumferential. Question 46. What organs are excised if an ovarian tumor is malignant? Option A, bilateral ovaries only. Option B, bilateral fallopian tubes and ovaries, uterus. Option C, unilateral involved ovary and fallopian tube. Option D, unilateral involved ovary and fallopian tube, uterus. The correct answer is option B, bilateral fallopian tubes and ovaries, uterus. Question 47. Which term refers to an abnormal thoracic curve of the spine referred to as hunchback? Option A, lordosis. Option B, scoliosis. Option C, kyphosis. Option D, alkalosis. The correct answer is option C, kyphosis. Question 48. What is the medical term for a bunion? Option A, talipes valgus. Option B, hellix valgus. Option C, hellix varus. Option D, talipes varus. The correct answer is option B, hellix valgus. Question 49. What incision is also known as a lower oblique? Option A, inguinal. Option B, paramedian. Option C, infraumbilical. Option D, thoraco-abdominal. The correct answer is option A, inguinal. Question 50. The apron-like structure attached to the greater curvature of the stomach is the option A, ligamentum. Option B, mesentery. Option C, omentum. Option D, peritoneum. The correct answer is option C, omentum. Question 51. The small intestine attaches to the posterior abdominal wall by the option A, mesentery. Option B, peritoneum. Option C, falciform ligament. Option D, lesser omentum. The correct answer is option A, mesentery. Question 52. How is the surgical informed consent signed if an adult patient is illiterate? Option A, authorized individual signs patient's name. Option B, patient marks with an X and witness verifies. Option C, RN and surgeon sign that patient gave consent. Option D, surgeon and risk manager sign consent. The correct answer is option B, patient marks with an X and witness verifies. Question 53. What is the term for a relationship in which two organisms occupy the same R and one organism benefits while the other is unharmed? Option A, commensalism. Option B, neutralism. Option C, mutualism. Option D, parasitism. The correct answer is option A, commensalism. Question 54. A topical steroid used to reduce inflammation after eye surgery is option A, depomedrol. Option B, Myocal. Option C, Helin. Option D, Widos. The correct answer is option A, depomedrol. Question 55. What direction should the stretcher be oriented when transporting a patient to the OR department? Option A, feet first, side rails up. Option B, feet first, side rails down. Option C, head first, side rails up. Option D, feet first, side rails down. The correct answer is option A, feet first, side rails up. Question 56. Which of the following routine preoperative laboratory studies would be ordered for premenopausal women with no history of hysterectomy? Option A, HCG. Option B, HBV. Option C, HIV. Option D, HDL. The correct answer is option A, HCG. Question 57. Which portion of the surgical gown is considered non-sterile? Option A, outside closure ties. Option B, 2 inches below neckline to table level. Option C, upper arms, neckline and axillary region. Option D, sleeves, 2 inches above the elbows to the cuffs. The correct answer is option C, upper arms, neckline and axillary region. Question 58. What is the surgical position commonly used for thyroid and gallbladder surgery? Option A, supine. Option B, Fowler's. Option C, reverse Trendelenburg. Option D, lateral kidney. The correct answer is option C, reverse Trendelenburg. Question 59. A congenital defect in which the fetal blood vessel between the pulmonary artery and aorta does not close is: option A, coarctation of the aorta. Option B, patent ductus arteriosus. Option C, tetralogy of Fallot. Option D, ventricular septal defect. The correct answer is option B, patent ductus arteriosus. Question 60. Which of the following is a commonly used preservative for tissue specimens? Option A, saline. Option B, formalin. Option C, ethyl alcohol. Option D, Lugol's solution. The correct answer is option B, formalin. Question 61. What is the first step taken for an incorrect sponge count? Option A, notify surgeon. Option B, X-ray patient. Option C, repeat count. Option D, complete incident report. The correct answer is option A, notify surgeon. Question 62. The mumps may be diagnosed by finding inflammation in which of the following glands? Option A, sublingual. Option B, thyroid. Option C, parotid. Option D, submandibular. The correct answer is option C, parotid. Question 63. What institutional document is completed when an adverse or unusual event takes place in the OR that may have legal consequences for the staff or patient? Option A, incident report. Option B, operative record. Option C, deposition report. Option D, advance directive. The correct answer is option A, incident report. Question 64. For which procedure would Trendelenburg position provide optimal visualization? Option A, cholecystectomy. Option B, hysterectomy. Option C, thyroidectomy. Option D, acromioplasty. The correct answer is option B, hysterectomy. Question 65. Which of the following is a non-adherent dressing? Option A, cling. Option B, collodion. Option C, adaptic. Option D, elastoplast. The correct answer is option C, adaptic. Question 66. Which of the following is a fenestrated drape? Option A, incise. Option B, aperture. Option C, half sheet. Option D, U-drape. The correct answer is option B, aperture. Question 67. What is the name of the urinary catheter with a small, curved tapered tip used on patients with urethral strictures? Option A, Iglesias. Option B, Cadet. Option C, pigtail. Option D, banano. The correct answer is option B, Cadet. Question 68. Which of the following terms describes a hernia that occurs within Hasselbeck's triangle? Option A, femoral. Option B, hiatal. Option C, direct. Option D, indirect. The correct answer is option C, direct. Question 69. Which of the following incisions is oblique? Option A, epigastric. Option B, Coker. Option C, paramedian. Option D, phalansteal. The correct answer is option B, Coker. Question 70. Which of the following dilators are used in the common duct? Option A, Pratt. Option B, Van Buren. Option C, Bakes. Option D, Hegar. The correct answer is option C, Bakes. Question 71. The organ that is connected by a duct to the duodenum is the: option A, pancreas. Option B, stomach. Option C, gallbladder. Option D, liver. The correct answer is option A, pancreas. Question 72. A brain tumor causing alteration of muscle tone, voluntary muscle coordination, gait and balance would likely be located in the: option A, pons. Option B, medulla. Option C, cerebellum. Option D, diencephalon. The correct answer is option C, cerebellum. Question 73. What is the term for a relationship that benefits one organism at the expense of another? Option A, mutualism. Option B, parasitism. Option C, commensalism. Option D, neutralism. The correct answer is option B, parasitism. Question 74. What type of disease is characterized by rapid onset and a rapid recovery? Option A, acute. Option B, primary. Option C, chronic. Option D, asymptomatic. The correct answer is option A, acute. Question 75. Which organelle is responsible for the production of energy? Option A, lysosomes. Option B, mitochondria. Option C, Golgi complexenberg. Option D, endoplasmic reticulum. The correct answer is option B, mitochondria. Question 76. What type of anesthesia is a combination of inhalation and intravenous drugs? Option A, spinal. Option B, regional. Option C, balanced. Option D, sedation. The correct answer is option C, balanced. Question 77. Who is ultimately responsible for obtaining the surgical informed consent? Option A, patient. Option B, guardian. Option C, surgeon. Option D, nurse. The correct answer is option C, surgeon. Question 78. What position is most commonly used for neurosurgical procedures? Option A. Supine. Option B. Semifallars. Option C. Lithotomy. Option D. Trendelenburg. The correct answer is option A. Supine. Question 79. Which of the following is a mechanical method of hemostasis? Option A. Laser. Option B. Thrombin. Option C. Ligature. Option D. Electrosurgery. The correct answer is option C. Ligature. Question 80. The outer layer of the intestine is the option A. Mucosa. Option B. Serosa. Option C. Muscularis. Option D. Submucosa. The correct answer is option B. Serosa. Question 81. Which of the following solutions should be used to prep the donor site for S-split thickness skin graft? Option A. Iodophor. Option B. Havegard. Option C. Chlorhexidine. Option D. Merthiolate. The correct answer is option C. Chlorhexidine. Question 82. What type of drape would be used for a flank procedure? Option A. Transverse. Option B. Aperture. Option C. Extremity. Option D. Perineal. The correct answer is option A. Transverse. Question 83. Where should the safety strap be placed on a patient who is in the supine position? Option A. Across the waist. Option B. Over the thighs. Option C. Below the knees. Option D. Across the abdomen. The correct answer is option B. Over the thighs. Question 84. Which surgical procedure is performed to correct an abnormality in which the urethral meatus is situated on the superior aspect of the penis? Option A. Epispadias repair. Option B. Hypospadias repair. Option C. Ureteroneocystostomy. Option D. Metotomy. The correct answer is option A. Epispadias repair. Question 85. Which thermal method of hemostasis utilizes intense, focused light? Option A. Laser. Option B. Bipolar. Option C. Harmonic. Option D. Monopolar. The correct answer is option A. Laser. Question 86. What is the most common cause of intracerebral hemorrhage? Option A. Hypotension. Option B. Meningioma. Option C. Hypertension. Option D. Meningitis. The correct answer is option C. Hypertension. Question 87. The larynx is located between the option A. Pharynx and trachea. Option B. Nasal cavity and pharynx. Option C. Trachea and bronchi. Option D. Nasal and oral cavities. The correct answer is option A. Pharynx and trachea. Question 88. The most common cause of retinal detachment is option A. Aging. Option B. Glaucoma. Option C. Trauma. Option D. Inflammation. The correct answer is option C. Trauma. Question 89. What postoperative complication is associated with total hip arthroplasty? Option A. Compartment syndrome. Option B. Upper extremity weakness. Option C. Urinary incontinence. Option D. Pulmonary embolism. The correct answer is option D. Pulmonary embolism. Question 90. Which of the following is a type of passive drain? Option A. Penrose. Option B. Hemovac. Option C. Jackson-Pratt. Option D. Plurivac. The correct answer is option A. Penrose. Question 91. What type of acquired immunity is a vaccination? Option A. Artificial passive. Option B. Artificial active. Option C. Natural passive. Option D. Natural active. The correct answer is option B. Artificial active. Question 92. When would the anesthesia provider request cricoid pressure? Option A. Beer block. Option B. Epidural injection. Option C. Endotracheal intubation. Option D. Endotracheal extubation. The correct answer is option C. Endotracheal intubation. Question 93. Which instrument would be used during a keratoplasty to remove the cornea? Option A. Trephine. Option B. Westcott. Option C. Oculotome. Option D. Phacoemulsifier. The correct answer is option A. Trephine. Question 94. What is the required minimum number of individuals to transfer an incapacitated patient from the OR table to the stretcher? Option A. 3. Option B. 4. Option C. 5. Option D. 6. The correct answer is option B. 4. Question 95. Which of the following regulations states that blood and body fluids should be considered infectious? Option A. Post-exposure prophylaxis. Option B. Medical Device Safety Act. Option C. Standard precautions. Option D. Body substance isolation rules. The correct answer is option C. Standard precautions. Question 96. Which of the following is a major source of distress for toddler and preschool age patients being transported to the operating room? Option A. Fear of anesthesia. Option B. Separation anxiety. Option C. Room temperature change. Option D. Lack of communication. The correct answer is option B. Separation anxiety. Question 97. Which structure has oral, nasal, and laryngeal divisions? Option A. Trachea. Option B. Esophagus. Option C. Glottis. Option D. Pharynx. The correct answer is option D. Pharynx. Question 98. Otoplasty is performed to correct a congenital deformity of which structure? Option A, ear. Option B, eye. Option C, nose. Option D, mouth. The correct answer is option A, ear. Question 99. An injury a patient sustains as a result of the care given by a healthcare professional is called: option A, tort. Option B, liability. Option C, battery. Option D, iatrogenic. The correct answer is option D, iatrogenic. Question 100. The highly vascular layer of the eye that absorbs light rays and nourishes the retina is the: option A, iris. Option B, choroid. Option C, macula. Option D, sclera. The correct answer is option B, choroid. Question 101. According to Maslow's hierarchy of needs, which of the following is the patient satisfying when she trusts the surgical team's abilities? Option A, belonging. Option B, esteem. Option C, safety. Option D, physiological. The correct answer is option C, safety. Question 102. Which aneurysm usually develops between the renal and iliac arteries? Option A, aortic arch. Option B, ascending thoracic. Option C, abdominal aortic. Option D, descending thoracic. The correct answer is option C, abdominal aortic. Question 103. The agent used to flush an artery to prevent clotting is: option A, thrombin. Option B, protamine sulfate. Option C, heparin. Option D, Ringer's lactate. The correct answer is option C, heparin. Question 104. What is the next step for reattachment of a severed digit after debridement? Option A, vessel reanastomosis. Option B, nerve reanastomosis. Option C, bone-to-bone fixation. Option D, tendon-to-tendon fixation. The correct answer is option C, bone-to-bone fixation. Question 105. What type of skin graft includes the epidermis and all of the dermis? Option A, pedicle. Option B, split thickness. Option C, composite. Option D, full thickness. The correct answer is option D, full thickness. Question 106. Which muscle type is striated and voluntary? Option A, heart. Option B, visceral. Option C, cardiac. Option D, skeletal. The correct answer is option D, skeletal. Question 107. Which of the following terms refers to absence of the external ear? Option A, anophthalmia. Option B, chylochisis. Option C, ectrosyndactyly. Option D, microtia. The correct answer is option D, microtia. Question 108. What is the recommended maximum time limit for a tourniquet to remain inflated on an adult lower extremity? Option A, 30 minutes. Option B, 60 minutes. Option C, 1.5 hours. Option D, 2.5 hours. The correct answer is option C, 1.5 hours. Question 109. Which organisms causes gas gangrene? Option A, Clostridium botulinum. Option B, Clostridium perfringens. Option C, Staphylococcus aureus. Option D, Staphylococcus epidermidis. The correct answer is option B, Clostridium perfringens. Question 110. Chest rolls should span the distance bilaterally between which two anatomical structures? Option A, nipple to umbilicus. Option B, iliac crest to iliac crest. Option C, scapula to gluteus maximus. Option D, acromioclavicular joint to iliac crest. The correct answer is option D, acromioclavicular joint to iliac crest. Question 111. Which ossicle of the middle ear covers the oval window? Option A, malleus. Option B, incus. Option C, stapes. Option D, utricle. The correct answer is option C, stapes. Question 112. What is another name for the Krask position? Option A, dorsal recumbent. Option B, jackknife. Option C, Trendelenburg. Option D, beach chair. The correct answer is option B, jackknife. Question 113. The vocal cords are located in the: option A, pharynx. Option B, trachea. Option C, larynx. Option D, bronchus. The correct answer is option C, larynx. Question 114. What type of sponge is tightly rolled cotton tape used by surgeons for blunt dissection? Option A, Raytec. Option B, Kittner. Option C, Wexel. Option D, Cotonoid. The correct answer is option B, Kittner. Question 115. Which of these instruments would be used during a keratoplasty? Option A, Kilner hook. Option B, Bowman probe. Option C, Carrison rongeur. Option D, Cottingham punch. The correct answer is option D, Cottingham punch. Question 116. A partial dislocated joint is called: option A, subluxation. Option B, malrotation. Option C, avulsion. Option D, malunion. The correct answer is option A, subluxation. Question 117. What condition is characterized by buildup of fatty deposits such as cholesterol? Option A, embolism. Option B, thrombosis. Option C, arteriospasm. Option D, atherosclerosis. The correct answer is option D, atherosclerosis. Question 118. Plaster rolls for casting should be submerged in which of the following? Option A, lukewarm saline. Option B, lukewarm water. Option C, cold saline. Option D, lukewarm water. The correct answer is option B, lukewarm water. Question 119. The avascular, clear portion of the eye covering the iris is the option A, cornea. Option B, sclera. Option C, pupil. Option D, conjunctiva. The correct answer is option A, cornea. Question 120. How often should surgical masks be changed? Option A, after lunch. Option B, every 2 hours. Option C, twice a day. Option D, after each case. The correct answer is option D, after each case. Question 121. Which term describes a rod-shaped microorganism? Option A, coccus. Option B, spirillum. Option C, bacillus. Option D, helical. The correct answer is option C, bacillus. Question 122. When using the warm cycle of the Edo sterilizer, what is the minimum sterilization temperature in Fahrenheit? Option A, 55. Option B, 65. Option C, 75. Option D, 85. The correct answer is option D, 85. Question 123. Which of the following actions would be a violation of the aseptic technique? Option A, cuffing the hands within the drape. Option B, sterile person reaching over sterile surface. Option C, repositioning penetrating towel clip. Option D, sterile surgical members passing face to face. The correct answer is option C, repositioning penetrating towel clip. Question 124. Which legal principle applies when the patient is given the wrong dose of the local anesthetic? Option A, residential ipsa loquitur. Option B, respondeat superior. Option C, bona fide. Option D, assault. The correct answer is option A, residential ipsa loquitur. Question 125. The space between the vocal cords is called the option A, vocal fold. Option B, glottis. Option C, epiglottis. Option D, cricoid cartilage. The correct answer is option B, glottis. Question 126. Which bacteria could be found in a penetrating wood caused by a rusty nail? Option A, Teponema pallidum. Option B, Bacillus anthracis. Option C, Clostridium tetani. Option D, Helicobacter pylori. The correct answer is option C, Clostridium tetani. Question 127. Which of the following retractors is used for spinal nerve roots? Option A, Taylor. Option B, Love. Option C, Cushing. Option D, Meyerding. The correct answer is option B, Love. Question 128. What is another name for the electrosurgical unit's patient return electrode? Option A, cautery. Option B, generator. Option C, foot pedal. Option D, grounding pad. The correct answer is option D, grounding pad. Question 129. What size of Foley catheter is commonly used for adults? Option A, 8 FR. Option B, 12 FR. Option C, 16 FR. Option D, 24 FR. The correct answer is option C, 16 FR. Question 130. What is the minimum number of minutes to sterilize unwrapped metal instruments with lumens in the gravity displacement sterilizer at 270 degrees Fahrenheit? Option A, 5. Option B, 10. Option C, 15. Option D, 20. The correct answer is option B, 10. Question 131. Which of the following tumors is typically benign, encapsulated, and arises from tissue covering the central nervous system structures? Option A, meningioma. Option B, astrocytoma. Option C, schwannoma. Option D, oligodendroglioma. The correct answer is option A, meningioma. Question 132. The fibrous white layer that gives the eye its shape is the option A, iris. Option B, cornea. Option C, sclera. Option D, choroid. The correct answer is option C, sclera. Question 133. What is the term for thread-like appendages that provide bacteria with motion? Option A, fimbriae. Option B, flagella. Option C, mesosomes. Option D, mitochondria. The correct answer is option B, flagella. Question 134. What surgical position provides optimal visualization of the lower abdomen or pelvis? Option A, Fowler's. Option B, Trendelenburg. Option C, reverse Trendelenburg. Option D, Krask. The correct answer is option C, reverse Trendelenburg. Question 135. How many hours must an item submerge in glutaraldehyde to sterilize? Option A, 7. Option B, 8. Option C, 9. Option D, 10. The correct answer is option D, 10. Question 136. When a patient's blood pressure is 135/81/135 refers to option A, diastolic. Option B, systolic. Option C, pedal pulse. Option D, apical pressure. The correct answer is option B, systolic. Question 137. A term referring to a waxy secretion in the external ear canal is option A, mucus, option B, sputum, option C, cerumen, option D, perilymph. The correct answer is option C, cerumen. Question 138. Which of the following is an ossicle of the middle ear? Option A, pinna, option B, incus, option C, labyrinth, option D, vestibule. The correct answer is option B, incus. Question 139. What is the term for the process of removing blood from an extremity prior to inflating the pneumatic tourniquet? Option A, extravasation, option B, evisceration, option C, exsanguination, option D, evacuation. The correct answer is option C, exsanguination. Question 140. Which of the following may require probing and dilating in pediatric patients with upper respiratory infections? Option A, sinus cavities, option B, eustachian tube, option C, nasolacrimal duct, option D, tympanic membrane. The correct answer is option C, nasolacrimal duct. Question 141. Which surgical team member is responsible for setting up the sterile field? Option A, surgical first assistant, option B, surgical technologist, option C, circulating nurse, option D, surgeon. The correct answer is option B, surgical technologist. Question 142. In what circumstances would cell saver transfusion be contraindicated? Option A, anemic patients, option B, diabetic patients, option C, cancer procedures, option D, orthopedic procedures. The correct answer is option C, cancer procedures. Question 143. Use of an intraluminal, circular, stapler, EEA, would be indicated for which of the following surgical procedures? Option A, pancreatectomy, option B, cholecystectomy, option C, polypectomy, option D, sigmoidectomy. The correct answer is option D, sigmoidectomy. Question 144. Satinsky, Herrick, and Mayo clamps may be used specifically on which of the following structures? Option A, kidney pedicle, option B, seminal vesicle, option C, bladder neck, option D, prostate gland. The correct answer is option A, kidney pedicle. Question 145. The minimum Fahrenheit temperature for sterilization to occur in a per vacuum steam sterilizer is option A, 249 to 255, option B, 256 to 262, option C, 263 to 269, option D, 270 to 276. The correct answer is option D, 270 to 276. Question 146. The nasal cavity is divided into two portions by the option A, vomer, option B, ethmoid, option C, sphenoid, option D, septum. The correct answer is option D, septum. Question 147. Which of the following is used by the surgeon to intermittently remove prostatic tissue fragments during a TURP? Option A, wire snare, option B, Ehrlich evacuator, option C, pull suction, option D, Randall forceps. The correct answer is option B, Ehrlich evacuator. Question 148. Which type of hematoma is a result of torn bridging meningeal veins? Option A, epidural, option B, intracerebral, option C, intraventricular, option D, subdural. The correct answer is option D, subdural. Question 149. In addition to temperature, time, and moisture, what is the fourth factor that determines the outcome of the steam sterilization process? Option A, concentration, option B, weight, option C, aeration, option D, pressure. The correct answer is option D, pressure. Question 150. The Bowie-Dick test is performed. Option A, hourly, option B, daily, option C, weekly, option D, monthly. The correct answer is option B, daily. Question 151. The spiral, conical structure of the inner ear is the option A, cochlea, option B, stapes, option C, vestibule, option D, labyrinth. The correct answer is option A, cochlea. Question 152. What is the name of the condition in which a loop of bowel herniates into the Douglas's cul-de-sac? Option A, cystocele, option B, rectocele, option C, enterocele, option D, omphaloceal. The correct answer is option C, enterocele. Question 153. Which of these conditions is characterized by a fleshy encroachment of conjunctiva onto the cornea? Option A, chalazion, option B, pterygium, option C, strabismus, option D, ecchymosis. The correct answer is option B, pterygium. Question 154. Which procedure would be listed in your schedule for a patient undergoing surgical treatment of uterine fibroids? Option A, pelvic exenteration, Option B, cervical circlage. Option C, colporrhaphy. Option D, myomectomy. The correct answer is option D, myomectomy. Question 155. Where is a Baker's cyst located? Option A, olecranon process. Option B, greater tubercle. Option C, popliteal fossa. Option D, carpal tunnel. The correct answer is option C, popliteal fossa. Question 156. Which of the following is a method of high-level disinfection? Option A, peracetic acid for 30 minutes. Option B, 2% glyceraldehyde for 20 minutes. Option C, steam under pressure for 10 minutes. Option D, hydrogen peroxide gas plasma for 75 minutes. The correct answer is option B, 2% glyceraldehyde for 20 minutes. Question 157. Another name for the tympanic membrane is the option A, ear tube. Option B, ear canal. Option C, earlobe. Option D, eardrum. The correct answer is option D, eardrum. Question 158. What is the burn degree classification that involves the epidermis and subcutaneous tissue? Option A, first. Option B, second. Option C, third. Option D, fourth. The correct answer is option C, third. Question 159. Which portion of the ear is affected by Meniere syndrome? Option A, inner. Option B, middle. Option C, eustachian tube. Option D, auditory ossicles. The correct answer is option A, inner. Question 160. The cartilaginous nasal septum is anterior to which bone? Option A, hyoid. Option B, lamar. Option C, mandible. Option D, palatine. The correct answer is option B, vomer. Question 161. The most reliable method for determining the efficiency of moist heat sterilizers is the controlled use of biological indicators containing the organism. Option A, Bacillus stearothermophilus. Option B, Clostridium tetani. Option C, Bordetella pertussis. Option D, Corynebacterium diphtheria. The correct answer is option A, Bacillus stearothermophilus. Question 162. Which neurosurgical pathway would a myelogram diagnose? Option A, subdural hematoma. Option B, Creutzfeldt-Jakob. Option C, spinal stenosis. Option D, myelomeningocele. The correct answer is option C, spinal stenosis. Question 163. Which of the following terms means a prolapsed bladder causing a bulge in the anterior vaginal wall? Option A, rectocele. Option B, cystocele. Option C, enterocele. Option D, herniation. The correct answer is option B, cystocele. Question 164. How many hours must the steam sterilization biological indicator incubate? Option A, 6. Option B, 12. Option C, 18. Option D, 24. The correct answer is option D, 24. Question 165. The nasal sinus located between the nose and the orbits is the option A, frontal. Option B, sphenoid. Option C, ethmoid. Option D, maxillary. The correct answer is option C, ethmoid. Question 166. What is the definition of otosclerosis? Option A, earache. Option B, tinnitus. Option C, tearing of tympanic membrane. Option D, bony overgrowth of stapes. The correct answer is option D, bony overgrowth of stapes. Question 167. Which of the following terms describes a fracture in which the bone penetrates the skin? Option A, simple. Option B, comminuted. Option C, compound. Option D, closed. The correct answer is option C, compound. Question 168. For which of the following procedures would a McBurney incision be indicated? Option A, appendectomy. Option B, cholecystectomy. Option C, herniorrhaphy. Option D, gastrectomy. The correct answer is option A, appendectomy. Question 169. What degrees Celsius is the steam sterilization biological indicator incubated? Option A, 43 to 48. Option B, 49 to 54. Option C, 55 to 60. Option D, 61 to 66. The correct answer is option C, 55 to 60. Question 170. What is the medical term for removal of the uterus? Option A, salpingectomy. Option B, oophorectomy. Option C, myomectomy. Option D, hysterectomy. The correct answer is option D, hysterectomy. Question 171. Which of the following methods removes small organic particles and soil from the box locks and ratchets of instruments? Option A, ultrasonic washer. Option B, manual cleaning. Option C, washer sterilizer. Option D, enzymatic soak. The correct answer is option A, ultrasonic washer. Question 172. What is the medical term for nosebleed? Option A, rhinitis. Option B, sinusitis. Option C, epistaxis. Option D, hemoptysis. The correct answer is option C, epistaxis. Question 173. What is the proper method for preparing a Fraser suction tip for steam sterilization? Option A, lumen is dry. Option B, distilled water in lumen. Option C, stylet is left inside lumen. Option D, disinfectant solution in lumen. The correct answer is option B, distilled water in lumen. Question 174. Which of the following is a telescoping of the intestines in neonates requiring immediate surgical intervention? Option A, intussusception. Option B, pyloric stenosis. Option C, tetralogy of Fallot. Option D, omphalocele. The correct answer is option A, intussusception. Question 175. What is the name of the procedure for the excision of the tunica vaginalis? Option A, spermatocoelectomy. Option B, orchiectomy. Option C, hydrocelectomy. Option D, vasectomy. The correct answer is option C, hydrocelectomy. Question 176. Which of the following is a type of tissue forceps? Option A, Brown-Adson. Option B, Peon. Option C, Hallis. Option D, Schnitt. The correct answer is option A, Brown-Adson. Question 177. Which endoscope is used to visualize the heart and major vessels? Option A, ventriculoscope. Option B, bronchoscope. Option C, mediastinoscope. Option D, angioscope. The correct answer is option D, angioscope. Question 178. The goal of the surgical scrub is to lower the population of which flora to an irreducible minimum? Option A, parasitic. Option B, resident. Option C, transient. Option D, enteric. The correct answer is option B, resident. Question 179. Which needle is used during the bladder suspension procedure for treating stress incontinence in women? Option A, Stamy. Option B, Chiba. Option C, Dorsey. Option D, True Cut. The correct answer is option A, Stamy. Question 180. Which procedure can be performed without making an incision to treat varicose veins? Option A, sclerotherapy. Option B, varicocelectomy. Option C, vein ligation. Option D, vein stripping. The correct answer is option A, sclerotherapy. Question 181. When repairing a direct hernia, the surgeon works within the anatomical triangle formed by the inguinal ligament, inferior epigastric vessels and the lateral border of the rectus abdominis called option A, femoral. Option B, anterior. Option C, Hasselbecke's. Option D, Kalos. The correct answer is option C, Hasselbecke's. Question 182. Which of the following is the correct postoperative sequence of actions completed by the surgical technologist? Option A, 1. Assist with post-op patient care. Option B, 2. Remove drapes. Option C, 3. Remove gown and gloves. Option D, 4. Break down sterile setup. The correct answer is option Nan. Question 183. 2, 3, 1, 4. Option A, 3, 2, 4, 1. Option B, 4, 2, 1, 3. Option C, wipe down furniture and surfaces. Option D. What should be completed before the sterile items are opened for the first procedure of the day? The correct answer is option Nan. Question 184. Wipe down furniture and surfaces. Option A, test sterilizer and substerile room. Option B, test anesthesia machine. Option C, autonomic. Option D, cardiac muscles are controlled by which division of the nervous system? The correct answer is option Nan. Question 185. Somatic. Option A, autonomic. Option B, central. Option C, ovary. Option D, O/O is the root word for which anatomical structure? The correct answer is option Nan. Question 186. Uterus. Option A, cervical OS. Option B, fallopian tube. Option C, vascular anastomosis. Option D. In which of the following would absorbable suture be contraindicated? The correct answer is option Nan. Question 187. Muscle. Option A, intestinal anastomosis. Option B, vascular anastomosis. Option C, bladder. Option D. During a cesarean section, which organ is freed from the uterus to prevent injury? The correct answer is option Nan. Question 188. Ureters. Option A, fallopian tubes. Option B, bladder. Option C, aseptic. Option D. Which of the following refers to the absence of pathogens? The correct answer is option Nan. Question 189. Aseptic. Option A, septic. Option B, nosocomial. Option C, DNC. Option D. Which surgical procedure would use Sims curettes? The correct answer is option Nan. Question 190. Colporrhaphy. Option A, LAVH. Option B, myomectomy. Option C, endotracheal intubation. Option D. What must be done prior to positioning a patient undergoing a posterior lumbar laminectomy? The correct answer is option Nan. Question 191. Padding of the knees. Option A, endotracheal intubation. Option B, skin prep. Option C, Pennington. Option D. What is also known as a Duval clamp, and is a surgical clamp with a triangular eyelet? The correct answer is option Nan. Question 192. Oxner, option A. Adair, option B. Pennington, option C. Cholesteatoma, option D. Which of the following damages the mastoid air cells and ossicles of the ear? The correct answer is option Nan. Question 193. Acoustic neuroma, option A. Cholesteatoma, option B. Otosclerosis, option C. 3/4 distance from the needle point, option D. When placing a swag needle onto a needle holder, the needle should be clamped. The correct answer is option Nan. Question 194. 3/4 distance from the needle point, option A. At the junction of suture and needle, option B. Halfway distance from the needle point, option C. Rigid bronchoscope, option D. Which endoscope is used for the removal of foreign bodies from the airway of a pediatric patient? The correct answer is option Nan. Question 195. Flexible bronchoscope, option A. Rigid esophagoscope, option B. Rigid bronchoscope, option C. Oxygen, carbon, hydrogen, nitrogen, option D. What of the following elements primarily make up the body's mass? The correct answer is option Nan. Question 196. Oxygen, potassium, hydrogen, sulfur, option A. Oxygen, carbon, hydrogen, nitrogen, option B. Oxygen, carbon, phosphorus, magnesium, option C. Bailey, option D. Which instrument is used to contract the ribs for suturing purposes? The correct answer is option Nan. Question 197. Sem, option A. Matson, option B. Doyen, option C. Gastrocnemius, option D. The largest muscle of the upper calf is the. The correct answer is option Nan. Question 198. Pyrrhoneus, option A. Gastrocnemius, option B. Quadriceps, option C. 3 hours, option D. What is the length of time when thrombin loses its potency? The correct answer is option Nan. Question 199. 60 minutes, option A. 2 hours, option B. 3 hours, option C. Absorption of nutrients, option D. The function of the small intestine is. The correct answer is option Nan. Question 200. Absorption of nutrients, option A. Production of bacteria, option B. Excretion of bile, option C. Dentin, option D. The teeth are composed primarily of. The correct answer is option Nan. Question 201. Cementum, option A. Enamel, option B. Pulp, option C. Electron theory, option D. The basis for the design of electrical equipment in the OR is. The correct answer is option Nan. Question 202. Isolated circuit, option A. Electron theory, option B. Ohm's law, option C. Vagotomy, option D. Which of the following procedures is performed to decrease gastric secretions? The correct answer is option Nan. Question 203. Vagotomy, option A. Billrothi, option B. Gastrostomy, option C. Obstructed bowel, option D. A patient who underwent an appendectomy enters the emergency department with severe abdominal pain, constipation and vomiting. Which of the following is occurring? The correct answer is option Nan. Question 204. Obstructed bowel, option A. Diverticulitis, option B. Strangulated hernia, option C. Duodenum, option D. Which organ shares the same blood supply with the pancreas and must be removed during a Whipple procedure? The correct answer is option Nan. Question 205. Duodenum, option A. Bladder, option B. Spleen, option C. Drill, option D. During a cleft palate procedure, which equipment should the surgical technologist be prepared to set up quickly? The correct answer is option Nan. Question 206. Microscope, option A. Nerve stimulator, option B. Saw, option C. Biceps brachii, option D. The muscle that flexes and supinated the forearm and covers the anterior portion of the upper arm is the. The correct answer is option Nan. Question 207. Biceps brachii, option A. Brachioradialis, option B. teres major, option C. Denial, option D. A surgeon tells a patient she has terminal cancer but requires a prophylactic surgery to prevent a bowel obstruction and the patient replies, "This can't be happening to me." Which stage of grief is the patient displaying? The correct answer is option Nan. Question 208. Depression, option A. Bargaining, option B. Anger, option C. Bypass calculi obstruction, option D. What is the purpose of inserting a ureteral stent catheter? The correct answer is option Nan. Question 209. Bypass calculi obstruction, option A. Excise calculi, option B. Prevent postoperative hemorrhage, option C. Shaver with a Bratter tip, option D. Which of the following instruments creates the trough on the anterior glenoid rim during a Bankart procedure? The correct answer is option Nan. Question 210. bone cutting forceps. Option A, shaver with a broader tip. Option B, reciprocating saw. Option C, parietal cells. Option D, which of the following spritz hydrochloric acid? The correct answer is option Nan. Question 211. Salivary glands. Option A, pancreas. Option B, duodenum. Option C, EEG. Option D, which of the following preoperative diagnostic tests would be administered to a patient with a brain injury? The correct answer is option Nan. Question 212. EMG. Option A, SAW. Option B, T. Option C, extremity. Option D, which of the following is a type of fenestrated drape? The correct answer is option Nan. Question 213. Three-quarter. Option A, extremity. Option B, split. Option C, mucosa. Option D, the walls of the vagina are lined with. The correct answer is option Nan. Question 214. Mucosa. Option A, serosa. Option B, peritoneum. Option C, harmonic. Option D, which type of scalpel use ultrasonus energy to cut and coagulate tissue? The correct answer is option Nan. Question 215. Hemostatic. Option A, harmonic. Option B, plasma. Option C, embolectomy. Option D, a Fogarty catheter is used during A/N. The correct answer is option Nan. Question 216. Thoracotomy. Option A, embolectomy. Option B, craniotomy. Option C, elbow pads. Option D, which of the following positioning devices is needed when placing the patient in the supine position? The correct answer is option Nan. Question 217. Elbow pads. Option A, Mayfield headrest. Option B, beanbag. Option C, conjunctiva tenons capsule. Option D, during a trabeculectomy, which two layers are incised at the beginning of the procedure? The correct answer is option Nan. Question 218. Pupil, lens. Option A, conjunctiva tenons capsule. Option B, sclera, retina. Option C, bowel. Option D, what instrument set should the surgical technologist have available in the OR when preparing for an inguinal herniorrhaphy? The correct answer is option Nan. Question 219. Bowel. Option A, vascular. Option B, biliary. Option C, Lucan's tube. Option D, which of the following is used to obtain specimens during a bronchoscopy? The correct answer is option Nan. Question 220. Suction container. Option A, Lucan's tube. Option B, 4x4 Ratex sponges. Option C, steel. Option D, which suture material would be used in the presence of infection? The correct answer is option Nan. Question 221. Silk. Option A, chromic gut. Option B, steel. Option C, blepharoplasty. Option D, which surgical procedure uses the Stevens tenotomy? The correct answer is option Nan. Question 222. Meniscectomy. Option A, laminectomy. Option B, blepharoplasty. Option C, gynecologic. Option D, which surgical specialty uses the Sims retractor most? The correct answer is option Nan. Question 223. Genitourinary. Option A, maxillofacial. Option B, orthopedic. Option C, strangulated. Option D, which of the following hernias can result in necrosis of the viscera? The correct answer is option Nan. Question 224. Strangulated. Option A, femoral. Option B, sliding. Option C, external oblique. Option D, when the surgeon makes a McBurney's incision, which muscle is encountered first and divided in the direction of its fibers? The correct answer is option Nan. Question 225. Rectus abdominis. Option A, internal oblique. Option B, external oblique. Option C, broad ligament. Option D, which of the following maintains the position of the uterus? The correct answer is option Nan. Question 226. Levator muscle. Option A, broad ligament. Option B, pubic symphysis. Option C, upper midline. Option D, transverse colectomy is incised through which incision? The correct answer is option Nan. Question 227. Oblique. Option A, paramedian. Option B, thoraco-abdominal. Option C, endometrial. Option D, which kind of uterine tissue can grow in abnormal locations including the ovaries, pelvic peritoneum, and small intestine? The correct answer is option Nan. Question 228. Cervical. Option A, endometrial. Option B, myometrial. Option C, ultrasound. Option D, which preoperative diagnostic exam is quickly completed to confirm ectopic pregnancy? The correct answer is option Nan. Question 229. Fluoroscopy. Option A, ultrasound. Option B, MRI. Option C, supine. Option D, how would you position a patient with an intertrochanteric fracture? The correct answer is option Nan. Question 230. Prone. Option A, supine. Option B, Trendelenburg. Option C, lateral. Option D, What position allows optimal exposure of the retroperitoneal area of the flank? The correct answer is option C, lateral. Question 231, Trendelenburg. Option A, supine. Option B, lateral. Option C, 2, 1, 4, 3. Option D. Which of the following is the correct sequence of instruments for placing a screw into bone? The correct answer is option Nan. Question 232, 2, drill. Option A, 3, screwdriver. Option B, 4, tap. Option C, decortication. Option D, the removal of fibrous thickening of the visceral pleura is. The correct answer is option Nan. Question 233, poudrege. Option A, decortication. Option B, segmentectomy. Option C, succinylcholine, anectin. Option D, the only depolarizing muscle relaxant in clinical use is. The correct answer is option Nan. Question 234, becuronium, norcurin. Option A, rocuronium, zamuron. Option B, succinylcholine, anectin. Option C, pantolin. Option D, what type of hernia involves a direct and indirect inguinal hernia? The correct answer is option Nan. Question 235, umbilical. Option A, epigastric. Option B, pantolin. Option C, lower leg flexed, upper leg straight. Option D, how are the legs of the patient positioned for lateral position? The correct answer is option Nan. Question 236, lower leg flexed, upper leg straight. Option A, both legs straight. Option B, both legs flexed. Option C, support and bind. Option D, the neuroglia of the nervous system. The correct answer is option Nan. Question 237, support and bind. Option A, conduct impulses. Option B, initiate reflexes. Option C, closed. Option D, the method of inhalation anesthesia that allows complete rebreathing of expired gases is. The correct answer is option Nan. Question 238, closed. Option A, semi-closed. Option B, open. Option C, surgeon. Option D, which member of the surgical team is responsible for protecting an unsplintered fracture during positioning? The correct answer is option Nan. Question 239, surgical technologist preceptor. Option A, surgeon. Option B, anesthesia provider. Option C, lead apron. Option D, what personal protective equipment should the surgical technologist don prior to the start of the extracorporeal shock wave lithotripsy procedure? The correct answer is option Nan. Question 240, eye protection. Option A, non-sterile gloves. Option B, lead apron. Option C, Yankauer. Option D, another name for tonsil suction is. The correct answer is option Nan. Question 241, Barron. Option A, Fraser. Option B, Yankauer. Option C, strap. Option D, which muscles relax when a small pad is placed under a patient's head in the supine position? The correct answer is option Nan. Question 242, deltoid. Option A, strap. Option B, pyramidal. Option C, state the name and dosage of the medication. Option D, when a medication or local anesthetic is passed to the surgeon, the surgical technologist should. The correct answer is option Nan. Question 243, state how much medication the circulator dispensed. Option A, hand the syringe to the surgeon with the cap on the needle for safety. Option B, state the name and dosage of the medication. Option C, Dingman. Option D, a type of bone holding forcepses. The correct answer is option Nan.